You'll have the responsibility for maintaining your device on an ongoing basis. It's really a partnership between you and your provider.
It's important when you're considering progressing forward to an implant of an intrathecal device that you understand that you're going to have responsibility for also appropriately caring for the device. For example, if you have an intrathecal pump, you're going to have the pump refilled at a regular basis. And it's going to be important that you think that you can go to those visits and keep on that schedule, because it's important that we care for the pump and fill it appropriately.
How often does the patient have to come back to have a refill? It depends from patient to patient. And what I mean by that, it depends on how much the patient is getting. And we can change the concentration of the medication. For instance, if we have 10 milligrams in 1 cc, or ml, if you will, and the patient is requiring to come back every month because the patient is using a significant amount of medication, we can increase the concentration of the pump, thereby spacing out the times that the patient has to come. We then drain the pump, and we know, based on interrogating the pump itself with a little computer system, how much we expect to be in the pump. And we drain the pump. We look at the syringe that we use to drain the pump, and we should have pretty much exactly what should be in the pump, or there's a malfunction, which alerts us to a problem. If we get back everything that we should get back, then we insert a syringe with the new refill. We refill the pump, and the patient goes home.
I think I'm every 3.5 months. I'll go in, they take a magnet, they find the porthole, they put a little needle in, they draw the little bit of morphine that's left in there, fill up a new syringe, put it in, fill you back up, you're done. It takes 20 minutes, you're out of there. There really is nothing that I have to do on my part except know it's there and take care of that area of my body.
When the patient comes back for a refill, typically we always ask the patient, how are we doing? Is your pain under control adequately? What's your level of functioning? Are you having any significant side effects? Those are questions that we ask automatically.
Also, these devices, eventually they have batteries, and the battery does not last forever. So at some stage, you'll have to have this pump replaced. If you were to have a complication, we may have to also revise the device. So it's important for you to understand that before you consider progressing forward with this therapy.
Now, I just had a new one put in January this year because the battery life is between 6 to 7 years. And they just can't go in and replace the battery. They have to go in and take the whole device out and put a new device in.
I tell my patients that essentially this is a marriage, and hopefully a marriage made in heaven, but we need to understand that there is not just a give and they take, or vice versa, but it is in fact a marriage. The patient has to take some responsibility in that we're doing an intrathecal pump that will require ongoing care from the physician and from the patient, and that we do expect the patient to take an active role in getting better, not only from a pain standpoint, but from an emotional standpoint, an active standpoint, and we are there to help the patient along those lines, but we can't do everything for the patient.
Your input's very valuable to us to help us work together to make a decision whether this may be the right therapy for you. Once you have a permanent implant or an implantation, it's very important that also we work with you together and have you take an active role, because this is, again, just one part of your therapy.
You'll want to be well-informed and confident before making the decision to try a device. Don't be afraid to ask questions. Most important, remember that this device won't take away all of your pain. It's up to you to take an active role in managing your pain and regaining the quality of life you want and deserve.